Hi, everyone. Good morning. So glad that you could join us today for the second day of our Drug User Health Symposium. I'm Shelley Facenti, and I'm your moderator today. I'm going to open by just going through a few quick housekeeping things. The first is that this is a webinar, not a regular Zoom meeting. That means that you are automatically muted for this webinar as attendees, but you can communicate with each other or with the panelists using the chat. Make sure that you pay attention to who is in the to line. It's possible to send messages to all panelists only, and then all panelists and attendees, which would go to everyone. So just look at what it says before you hit send and make sure you're sending it to who you intend. If you have questions specifically for the panelists, rather than using the chat to communicate, please use the Q&A feature, which is at the bottom of your screen. You should see Q&A. If you click on that and ask a question, then we'll know that that's a question you'd like them to answer as part of the session, and I will go ahead and pay attention to that and moderate and ask them. The other option is if you would like to ask it yourself, if it's something you don't want to write in the Q&A because it's too complicated or for some other reason, you can go ahead and press the button that says raise hand at the bottom of your screen, or in the participants panel, you can raise your hand by pressing that button. And then we will see a little blue hand that comes up and lets us know that you'd like to raise your hand. We can unmute you. You won't be on video, but you can actually speak and everyone will hear you. So that's how you can communicate with us today. And after this session at 10 o'clock, after we stream a 5-minute video, we will actually do breakout rooms, and then you'll be on video and able to talk, and there'll be a lot more interaction. So that's how things are set up today. We will be recording today. And the other thing is you should have received a link to download a booklet. There's like a 100-page or so participant booklet that has the agenda and other information. If you did not receive that link, please, you can chat to Cindy Maxim, who's a panelist, if you can find her in the chat, or you can email her at her contact info, which I'll drop in the chat when I'm done talking, and we can make sure that we get you that booklet. My last piece is a big thank you to NACHO, the National Association of City and County Health Officials, who has with their funding, made this available and supported this symposium to happen. So we really appreciate their commitment to supporting the health of people who use drugs. All right, that's all the housekeeping. We made it. So now I would like to introduce 3 amazing harm reductionists here to open our session, Elevating Equity in Harm Reduction. These folks are here to talk about the value and importance of people of color in harm reduction leadership. And so with that, I'd like to introduce Rachel Cabogao, who works for the San Francisco Department of Public Health, Roy Tidwell from Code Tenderloin and Care Ambassadors, and Felony Castro, who works for Glide and also works for Homeless Youth Alliance at their Safe Sleeping Village. We're really excited to have you all here. Thanks so much.
Oh.
Thank you, Shelley.
Alrighty. Thank you, Shelley.
You're welcome.
Okay. Alrighty then. So, thank you so much for coming to the People of Color in Harm Reduction Leadership, a Success Story panel. My name is Rachel Cabogao. Again, I work for the Health Department, and thank you so much for having me on this panel today. And so I'm just gonna skip through real quick. Alrighty. As we know, San Francisco has been a leader in providing harm reduction services to people who use drugs and are experiencing homelessness. In spite of the number of notable achievements of the harm reduction movement, communities of color continue to be impacted by the war on drugs, are disproportionately affected by HIV, Hep C, opioid overdose mortality, and are underrepresented in the harm reduction workforce. Furthermore, San Francisco has undergone a rapid change of landscape due to massive displacement of people experiencing homelessness and use drugs fueled by gentrification, the tech boom, police harassment, and NIMBYism in the last 10 years. These forms of structural violence compel communities experiencing homelessness to migrate to the industrial neighborhoods predominantly populated by Black and Brown communities outside of the downtown districts, where most of our harm reduction-based programs and resources are saturated in. They remain in constant movement and in isolation. As people relocate into these neighborhoods, these Black and Brown communities who reside in public housing already have limited access to harm reduction services. It is also notoriously known among community members living in the projects to trust no community services associated with the health department because of generational trauma, continuous distrust with various institutions, and failed capacity building attempts and interventions made by community healthcare professionals with quote unquote good intentions who do not understand the culture and the values of the residents. Therefore, our health department and our city's harm reduction programs recognize that our communities of color, specifically Black, Indigenous, and Latinx communities who use drugs, experience homelessness, and identify as LGBTQ+, are the most vulnerable to infectious diseases and fatal opioid overdoses. Going to bounce back here. So the health department received funding from the CDC, and it was allocated to our Mobile Health Access Points collaboration, which composed of the San Francisco Department of Public Health, GLIDE, and the San Francisco AIDS Foundation. This collaboration was designed to specifically conduct street-based harm reduction services, such as free and confidential STI testing and treatment, syringe access and disposal services, and various nursing services. We offered and operated these services in vans by parking in close proximity to encampments, conducting street-based outreach and engagement from one tent to the next, and consistently showing up on a regular schedule for folks who ultimately dictate the services that they're interested in utilizing. We believe in a community-driven approach and working from the ground up. We build relationships with people on the street by earning their trust, by listening to their concerns, and honoring their ideas around what they need to survive while using drugs, by following through with actions and resources. They are the experts of their own survival and safety, and the collaborative efforts and services that we brought to them are centered around their partnership with us. And that partnership was a process that took constant experimentation, constant trial and error on finding out what works for the community and what doesn't. So, what does it mean to build relationships with communities of color who use drugs and mistrust public health providers, usually with good reason? Well, to start off, a consistent community-based outreach and shared dialogue about desired services. For instance, in Potrero Hill, a neighborhood that has public housing and squatters who live in abandoned buildings, we had to figure out from the ground up, where do people buy their drugs? What harm reduction supplies does this population of drug users need? Which community organizations already have pre-existing relationships with community members? And what services don't exist that people would be interested in? Over time, we found what cross streets worked best for people to access our services. We introduced and provided Narcan distribution and overdose prevention education. And we gained the community's acceptance around harm reduction by gradually introducing the supplies on the down low to straight up setting up shop as a mobile syringe access site where everyone can see what you're using, and it's completely normal to access these supplies. Alrighty, and then,
You mind if I mention something that was really instrumental right there? Is one of the things, and was when we first parked our vans there, is you would walk with an outreach worker that came with me door to door in the entire neighborhood, door to door, the whole way. And it's hilly, extremely rough terrain, but me and Roy would be back at our respective vans waiting for folks, but you would let everybody know the services that we brought out. And that was huge, because I think that's a personal touch to just, hey, here we are, this is what we do. And by continuing to do that on the very front end, I think that made big outcomes that were great, and as we move through this. And I just didn't want that to go without being said, because that's going to each individual home, each individual sometimes on the street, and just introducing yourself or introducing us, even though we might have been the next street over. And I think that's huge.
And also we just have to, it took about a couple of weeks of us just pulling up and letting our face be seen and not doing no outreach to kind of get the lay of the land, to get folks used to seeing us, you know, and getting in contact with, you know, the key people out there to let them know who we was before going out into the community. Because it's not safe to just go and just go and start knocking on people's doors without them getting a clue, having a clue of who you are, right? And so I think
Right.
that's important to.
Yeah, it's really important to acclimate people to our presence. You know, we're not here to invade space and take up space. We're here to share the space and gain trust, right? So, returning back to this next slide, connecting with women of color who are experiencing homelessness and use meth to client-centered harm reduction-based family planning resources. Well, our health department had an activation period where there was a syphilis outbreak among women of childbearing age who used meth, experienced homelessness, and were susceptible to congenital syphilis if they were pregnant. And so some of the takeaways that I personally took away from this experience was representation matters. If the providers look like me, have lived life, have experienced life like me, and understand how my racial and gender identity impact my sense of safety, I will trust them more because they will more likely understand what that struggle is like, and it will not be questioned. And also just keeping in mind of working with communities of color, if they've had a history of mistrusting healthcare providers who don't look like them, it might be triggering and more challenging for folks of color to trust a provider that doesn't look like them or identify as them. Another important thing I'd like to bring up is that privacy matters. Just because our folks live outside doesn't mean they want the whole world to know what their business is like. And we need to be aware of what the power dynamics are on the street and respect the privacy matters of our clients so we don't unintentionally put them in danger. And then my last takeaway from this was people need to believe and respect the wishes of women who use drugs, even if their choices may jeopardize their own health and their baby's health, because we're here to support them with the knowledge, options, and resources to help them make their own autonomous decisions on what they believe is right with their reproductive health. Any of y'all want to touch on this real quick before we move on to the next slide?
Rachel, and also, I don't know if you mentioned the food bank that we did every Tuesday. Me and you did every Tuesday.
Oh, yeah. You want to touch more on that? Go ahead.
Yeah, so before we started to go out there, we did a food bank. Was it every Tuesday?
It was every Tuesday. Yes. It started out every Tuesday and then once a month. Yes.
Yeah, and that way we was able to build organic relationships with people. When people started to see us out in the community, so they already knew who we was, right? And yeah, I just wanted to put that out there that it is so important to not just show up,
right?
Just, and just start because our purpose of doing this is to ask the community what it is that they needed from us, even if they wanted us there. Because I believe that West Point made it clear that they didn't want us there, and we stopped going, so.
I think the food bank thing, what it did is, like you said, show our faces more often, but it also got us, the food bank was a thing where mostly all the women of the community went to. And so that put our services, the entryway into our services at more of their, in their mind as something they could do, and in a realm where there was a lot more women, so they could feel more comfortable about that. And I just noticed that on those days when it wasn't food bank, and I'd have women coming up because they had talked to you or they had talked to Rachel, and because a lot of times I wasn't at the food bank thing, and their stress or anxiety was a lot more reduced, and that made it easier for me to have a conversation with them about their sex and drug use, and it wasn't like starting from zero. There was already a relationship that was being built, so I'm just continuing on with that. And when you talk about that one place where we kept showing up, but community didn't come out, it was different than community had changed because of the new housing. And so we got to see that it wasn't the same community, and they don't operate the same as they did before, because it did such a wholesale change that we had to change with it. We weren't required there, so hey, we got to get up and move and find another place with some folks that have a need for services, and see if they want us there.
Absolutely. Thank you.
And I just wanted to also say, like in these communities, you know, me being from communities like the ones that we served in, and these communities are so used to people coming in and getting their numbers and then cutting out, right? No relationship, right? And
Right.
I just appreciate the, you know, for the people that were our superiors gave us the freedom to be a people first team, to where, you know, like, cause we weren't getting any numbers at first.
No, not at all. It was a gradual build.
Yeah, we weren't getting any numbers, and we were people first, or people over numbers, and then the numbers, as we built relationship with the people, and the numbers built up, you know.
That's
and
exactly what happened.
and I just wanted to, you know, point that out. I just wanted to point that out.
Yeah. I appreciate that so much, because that's basically what we really want to get across to people, is that the relationships come first and then the data comes afterward, really. You'll get your numbers once you start connecting with community. And then just wanted to touch base on this pertaining to the question, what does it mean to build relationships with communities of color who use drugs and mistrust public health providers? Provide continuous street-based care regardless of ongoing displacement occurring in neighborhoods populated by people experiencing homelessness. In short, the COVID-19 pandemic has temporarily disbanded the Mobile Health Access Points Collaborative, and each agency has done their own independent efforts to support the community during the pandemic. And in order to continue to provide the similar care and resources, it is my experience, in collaboration with the Department of Public Health's street medicine team, that we were persistent in making multiple attempts to engage without judgment or expectation of the results to provide communities of color we were already serving through the mobile health access points to the same street-based services on a similar schedule, as well as provide the tools and the resources to prevent the spread of COVID in the community. My street medicine colleague, Alex Stroh, and I have continuously maintained our relationships in the Bayview district, as well as obviously Roy and Felony, and we've been doing so and have collaborated also with the Harm Reduction Therapy Center to keep providing communities of color who use drugs tools and resources that are harm reduction based. So anybody want to add on to that really quick before I read this quote from Petro Hill?
You said something about connecting more with street medicine, which is, we were doing that when we were together as opt-in, Glide and Health Department and San Francisco AIDS Foundation. And then when COVID happened, I know y'all were tasked with something different but similar, but we weren't connected like we were. Because I know when I went on the van, and now all of a sudden I have a van full of stuff, and where's my partners? And so everything was different, and I just kind of shifted, just continued to go out to communities. I don't know if we'll talk about this now or later, but I ended up seeing a lot more people because I went to places we weren't before, because we were tied into two vans. So, you know, I got in a van and just went. And I wasn't able to test because of COVID-19. So it means I couldn't have somebody in the van because of the close proximity. But what happened is, and I got action in getting a bunch of meals. Then I got action in getting tents. And then I just decided, well, we love that part of the town and we're just going to flood it. And there's a whole lot of people out there that were, COVID-19 is happening in downtown. It makes a difference. There's a lot of people everywhere, but now there's all these people that we know, because we see them, that are living on the east side of San Francisco, that are outdoors, that are in the elements. Many didn't have tents, many didn't have sleeping bags. Some are substance users, some are not. Just because somebody's outdoors doesn't mean they use substances. It helps because it keeps you warm if you're they're freezing, but they need services. And so whatever I had, I would just empty the van with as many people as I could, whether it was food, drug use supplies, whether it was something to keep yourself clean, washcloths, hygiene kits, tents. Um, in the first 3 months, I think I passed out over 600 tents out of that van. I'm looking at numbers from just in the half of March. I mean, I seen like thousands of people, thousands of one-on-one contacts during those months. And I could not have seen that when we were tied together because we would stay in our mobile healthcare site for like 2.5 hours. But having the ability and flexibility of going where I just seen fit, because I would just go until I seen somebody. And then I started seeing you all, and we were like crossing paths a lot. And it felt good knowing that, we were broken up initially. We were still serving the community that we went out to. And I do want to touch on, it did make a big difference having Roy as part of our team, because Roy's from the area. So there's a lot of elements to that, and it's history that he was helpful to me. Yeah, I'm a person of color, but I'm not from this neighborhood. And so to have a little bit of background on some of the areas means that I can engage people in a different way, that I know a little bit about it, but I'm definitely no expert. And then I can also, my part of relationship building is having people teach me about their neighborhood. If they tell me something important about their neighborhood, it's something that I need to know in the future. And I think that's a helpful thing to know about.
And I just wanted to also share that. So we went to Huntersville, and we went out there for I don't know what 3-4 months. We didn't see many people. The community let us know that they didn't want us out there, right? And I later ended up getting a job managing the wellness center there in Huntersville, and I was able to help some people because of they seen us out there, right? And I've heard, people came to me, man, you just don't quit, do you? You just, but we was able to get folks connected to services. So it's like the work that we put in, folks are still benefiting from it, even as we go to, move on to other jobs or move on to doing other things because of the relationships that we built.
I'm not moving on. You started this stuff. I'm keeping this stuff going, man. And I'm going to tell you, one of the other things that Rachel did by going out, and you as well, especially when out in the food bank, there were times when I'd roll up to a spot, and I remember there was this one woman that would come out and be a little way more forward than I would be, and yell out to the whole community, hey, come get your cooties checked, felonies here. Maybe not the way I would say it, but you know what she did is she made it okay for the van to be there, for me to be. She gave me instant access to many more residents than I could have done on my own. And even with Rachel and Roy, she just added that extra level of like validating our being there and saying, hey, these cats are cool. You can trust them. They're here for us. They're not here for, like you said, Rachel, the numbers. And I think that's really important in other areas. If you can, when something is set up, that's not set up to deliver these numbers, and that's all everything is fit towards, because being able to deliver to people and not knowing exactly what the people are going to ask for is important, because that's going to determine how we move, how we operate, and I think it's going to ultimately affect the type of relationship building or the effectiveness of relationship building when you go out.
And I think so Potrero Hill was challenging, right? But I think that Sunnydale, right? So those were the two most underserved neighborhoods in San Francisco, and our Sunnydale was like, man, it was rough because the setup is different, the people are different, and we were able to set up like a satellite syringe exchange there unofficially, right? With the guy, and we were hearing about overdoses, and we were getting phone calls. We need this over here. I need this, and I met a couple. One of the guy the guy was gay, and it was a female. They were, you know, and they traveled and they did sex work together, right? And he used fentanyl, and she would call me. We need overdose. This fool done overdosed again. I need some more Narcan. I would get them condoms. I would bring them things, and they were building relationships like that. And and so I remember the day when we was in Sunnydale, and we started just pulling up and setting events, setting up the harm reduction stuff, and we had the engagement with the trans woman, right? And that was a proud moment for me, because we was able to have Rachel was able to have a regular conversation with her, and talking about, you know, the things that she wanted to talk about, and the things that she needed, and we was able to meet those needs, you know. And it's just it's I still get they still hit me on Facebook, where y'all at, when y'all coming back, or where can I get this? I get a phone call because my number's the same, and it's, you know, yeah.
Yeah.
Can I get?
I'm
sorry, Rachel.
Oh, no, it's all good. I just wanted to share, you know, with providing continuous street-based care, I feel like for me, it was important in terms like one really good example was when, you know, we met when I first came to this encampment in the Bayview called Gerald and Rankin. You know, you just see the conditions that people are living in. They are living alongside like railroad tracks, and they're in the dark, and it's this industrial space. And I had met this woman that was 3 months pregnant, and basically, you know, when I was there, I did not just, you know, provide services and just show up and just made my appearance. I built a relationship with this woman to the point where, you know, I saw the conditions she was living in. I knew about her relationship with her partner. I witnessed the exchanges that she had with her partner, whether they were good, whether they were bad, the ugly. And that relationship had grew into like her engaging with our nurse, Alex, and her engaging with getting tested, keeping up with prenatal and family planning resources, to eventually getting her connected with a group which basically helped her get temporarily housed. And then there was one moment where I was just like in awe, because I was at the hospital here in San Francisco with the same woman holding her baby. And it was really profound for me, because it's like, I knew where your mom came from. I knew what it took for her to get from where she was to where she is now. And so that relationship is still ongoing today. So that way we can keep connecting with her and her community, and know that this isn't just like we're doing the standard like services. This is ongoing care. And we show up to provide that ongoing care and build trust and keep serving, because we want to be able to provide services to people that don't have these kind of access to services in these communities. So is there anything else that people want to touch upon before we move forward with the other slides?
You know, in that same neighborhood, I don't know if Roy was still with us. What's going on with the audio? Anyhow, so there's one that first I seen the sun.
You static.
So is it still going? We're good now?
You're good.
Yeah.
Anyhow, so this young boy, maybe around 8, 9 years old, who would come by the van and just look in the van and what's that for? And what's that for? And I showed him, and he was pointing at something. There were razors. So I showed him the razors, and there was nobody else around. So I showed him shaving cream, and we kept the guard on the razor, and he acted like he was shaving, right? And so, like another day or two later, this woman comes by, and yeah, I heard you met my son, and she and then he comes around, and oh, okay, well, so this woman with 3 kids that were right in that area. And I found out that the reason that they were displaced was by choice. She had left a domestic violence situation that wasn't far away and made the choice to take her and her children out of that home into a very dangerous environment so that they wouldn't continue to experience domestic violence. And I thought that was like extremely brave, but also to have her kids, and they were just all wonderful, positive, beautiful people, but then like rely on us from time to time to get these basic things done while she was figuring out her next move. Was it was just, I don't even have words for it, but to be able to be put in that intersection of her life and be able to make a difference in some small way to let her know that there are people that can help you. And if you're cool with it, if you allow me to make an introduction to some of these other agencies, which did happen, but we never knew what we were going to see. And that was that particular intersection was like an in-between of the city, a traveling place. And I know the day that they, and I hate the word resolve because it isn't resolving, you're eradicating people. The day that they got rid of all the tents with a bulldozer, Rachel was with me in the van, and that the people weren't in the tents for the last couple of days, but still watching that happen, and watching what looks like lives getting swept up in front of a bulldozer was really difficult. And that's part of what we got to brace for, because it's not always going to be fun. It's not always going to be spectacular. Some of it's going to be very heartbreaking. So I think something you said early on is not getting caught up in the results and the numbers and stuff make a big difference.
All righty. So thank you, Melanie. So this was a quote from our Potrero Hill community. It would be nice to have access to the same services people get downtown. It would be nice to have alcohol pads, tampons, pads, socks, and toothbrushes for free. You have to leave the neighborhood to get all that stuff, and people out here have to steal to get the same stuff. So I'm just going to move over to this lovely slide. So why did it work? Anyone want to dive in?
It worked. It worked because we wasn't invested in the outcome. We didn't have our motivation was, we made it clear. We all met before we went, and we made it clear that we are there to give the community what it is that they need, and not what it is that we want to give them. And it worked because we were patient. We were there for months, a couple of months. We didn't have any results, and it worked because we were open-minded. We were open to everybody, and it worked because it worked. You know what I'm saying? That's really.
Do you remember you brought me a girl to test at Potrero Hill? And when she got in the van, she really wanted to test, but she didn't want to test right in that spot because our vans were right next to each other. And she lived, we were basically in front of her house. And I asked her, well, what would be better? And she asked me, how about next week you park down the hill? And so next week we showed up, your van stayed where it was, and I went down maybe 100 yards back at the bottom of the hill. But when she showed up, she was so happy because it just gave her that distance she needed. And by doing that, it also sparked other conversations with other people that were in that neighborhood. And wow, we probably tested 40 people during the time that we were there for anything from HIV, Hep C, chlamydia, syphilis, and gonorrhea. And it was just amazing. And that had a lot to do with it too, being able to listen to people say something as simple as, can you move that just around the corner?
Excellent. So we work for numbers first organizations, but we are people first people. Anyone want to unpack that real quick?
Well, you know, I know what it's like to be treated a certain way and not be treated fairly, whether it's because of who I am or the color of my skin or whatever, I don't know. And I notice a lot of people that we've met, they've had experiences like that. And they're not always obvious when I first meet them. But I think we did a pretty good job where people would tell us why things didn't work for them and the places they went. And so we made, I know I paid attention to the places that they talked about and how they were treated and make sure that not only were they not treated that way, but to possibly go out and do some site visits and talk to people at other organizations and let them know, hey, this is something that's gone on. You know, give them the heads up, give them the chance to alter the way they welcome people.
Yeah, and numbers first is you know, it's hard working for, you know, cause the numbers is what get the funds to help people, right? And but what's the use of you get the funds and you don't have a relationship with the people? It's like throwing it's like it's like outreach without a heartbeat, you know, and so being people first is about the people, and it kind of gives, you know, building relationships, those long-lasting relationships, you know, and it causes people to, it helps people. So I've seen people change their quality of life over, you know, over time from just being people first, you know, and so and people know, they know, like, you know, you're here just to get your numbers. Okay, give me my gift card, give me my, versus, you know, when we go and people sit and they park and they want to talk to us, you know, and you know, I just Rachel was all heart, you know, it's like going in, it was like, man, we got into a couple of arguments because man, you need to slow down, you need to wait on, and you know, bro, I don't have time to. She's all heart, fearless, and and you know, she was a people part. She's a people first, people over numbers. You know, a person. You know, and I think that's what also why it worked, because that's what we were. We didn't really care about the numbers. You know, and I also like to thank, you know, our superiors, Eileen, Robert Hoffman, Paul Harkin, that, you know, gave us the freedom to just be who we were.
Yeah.
You know, and I was honored to you know, work with you guys and do that work and take, you know, this work to places that to love on a community that's so used to getting overlooked in these communities, and to show up and just, you know, be a part of the solution and not just, you know, come through there because it's an election, or there's a motive for this, or we just went through there because we wanted to help people, help meet people where they was at, you know, and so yeah, it was you know, an honor.
You know, I remember Janet used to be my boss too, and she used to always say something. She'd say, "Free yourself," and I felt like even though we had some challenging times, and we had our own relationship building as a team to go through, I think that was great because we had to go through that as we were building relationship with community. So they kind of were instrumental on how we dealt with each other, because things that were important had to be important to us as we related as a team, and I think that made a big difference too. And you know, it really makes it's always going to make an impact on how I continue to go out, whether it's as part of a team or with myself and my coworker. And it's going to make a big difference because I pay attention to communities differently. And I'm going to places where I don't live. So it's really important for me to get informed by the community about the community and not go with somebody's set agenda, because that's going to be skewed and it's going to derail me. So that's not a good way to do it.
Frank was always the mediator. Poe Frank, he was always the mediator between me and Rachel. Me and Rachel, we used to go there like cats and dogs. About, you know, it's to be mainly about her. I felt like she was like, you need to, like, let me go with you. Like me being overprotective. Bro, I don't need you to protect me, you know. And finally, and Frank used to balance us out, and then we would go at it right before we go out, and then we would go out and do the work, and then we would be cool after, we would be okay afterwards. But it was you know, when you got people that love hard like that, you fight hard, and we, you know, we work hard.
Absolutely. And it was just a growing process for all three of us. And I feel personally very privileged to work with Felony and Roy. They've brought perspectives in the work that are just undeniably valuable. And I'm very happy and very lucky to be part of this collaborative with such amazing people. So um, I guess we are ready for questions. Shelley, open it up.
I just mentioned something. I want to thank whoever put the slides together, because you put a quote in there that I've mentioned before, but I keep it written inside my van because it's really important to me. It's, people aren't going to care about how much you know until they know how much you care. I think that was us out there.
Thank you. Thank you so much to all of you. We're going to keep the panelists here and have about a little more than 10 minutes for Q&A. So please go ahead and either put questions for these panelists in the Q&A portion of the webinar down at the bottom where you see Q&A, type in your question, or if you'd like to just ask them a question directly, go ahead and hit the button that says raise hand, and we will unmute you. Great, we have a question here. Oh, the hand went down. Here we go. All right, Eileen. You can, there you go.
Okay. Sorry, I was waiting for others to join in, but I really want to emphasize that, you know, we had flexibility with this funding as the health department. And I mean, this is a clear example of just really needing to step back and allow the experts that work with the community to do their work and to follow their intuition, to follow their gut of like what will work and what will not work. And so it was a test for all of us in leadership positions to just kind of really step back and just like let them go, let them do what they know because they know the community. And just to see it evolve from not making the connections to suddenly a community that notoriously did not have harm reduction supplies. Suddenly this team had a really strong relationship. To this coincided, as Rachel mentioned, with the syphilis, increase in syphilis numbers amongst homeless women, and to have this ability to have this van and to bring these services together as a collaborative to the community was awesome. And so I just really want to highlight that the three of them are really downplaying the success of the work that they did. And I look forward to an opportunity where we can reconvene and think, how can we navigate this sort of collaboration again in the time of COVID? So thank you guys so much.
There's a Susan, she asked the question, how do we recruit people of color to become part of our harm reduction programs? And that is a perfect question. Like, thank you for that question. So the best harm reductions are the people that we serve. right? They are the experts. Uh, um, the, I have colleagues now that were people that came to the harm reduction center and got syringes. Now they are my colleagues, you know, in this field, and I think just like Eileen said, even uh, working side by side with someone, like just because a person use drugs doesn't mean that they can't do the work. Like, so what people do is they lump homeless people into this lump, and you are homeless, so you fit that category, right? And since you homeless, you must be this way, and it's not true because you know, as all of us know, we have conversations with people, and people excuse me for saying homeless, people that are experiencing homelessness um, have different reasons. Some people want to be out there. Some people lost, lost a spouse, lost some children, had a mental break, couldn't take care of themselves, and they end up, and uh, and just the relationships are healing, right? Having a open, shame-free, guilt-free relationship is healing, and people. I've watched people lives change from that. You know, I worked down at the Harm Reduction Center for 5 years, and over those years, I've watched people come in and you looking like you know it wasn't a hope in the world for them to coming to working alongside me to us to doing on to do better things, you know. So I say, you know, in order to recruit people uh, for the harm reduction program is to recruit the people that we serve. You know, I just have to happen to have an eye and feel, oh, it's something, you know, you got something there. Let's, you know, hire this person, you know. And
Don't you think you ought to also, like, if an agency doesn't have anybody that's from a location, that it makes sense to do outreach and go to that location and maybe ask. You know, people are interested in those services. Hey, do you know anybody who's interested in this work? Because then you're actively asking the community if they can kind of pull somebody from there. And you know, the other thing too, I think, is also when you get people in harm reduction that are people of color, and I think this goes for anybody too. If somebody's still using drugs, let's not vilify them, support them, because I have lots of friends that use drugs, and I support them whether they're working in harm reduction or not, and I don't judge them. That's their thing. Guess what? Why am I going to treat somebody different because they're not a community member, they're my friend or my colleague or whatever? And but people need different levels of support, no matter who they are, where they are, or my relationship with them. I think that's important to also kind of build into that because you know we're all human, we all have our different stories, and I think it's just really important to just keep building relationships no matter who and where you're at.
Thanks. We have another question in the Q&A. Do you have any suggestions for integrating outreach into syringe service programs or public health when higher ups are requesting personal client data for proof that it actually works, or to secure funding to have a regular outreach team and program?
That requesting personal client data, that's troubling to me because that's private information. I mean, we document the hell out of everything that we do, and I don't put a name by every number. I won't, because that's private, and I want to always maintain their confidentiality, or else this thing goes to shit. Sorry for using it like that, but I mean, building relationships is one thing, maintaining confidentiality and building trust is part of that. When I tell you that the information I'm collecting isn't going to go anywhere but with me and the person actually doing the results part of this test, then they have to, you know, in order for them to believe me, I have to make sure that I protect it when I'm not around them. Right.
And
that's kind of integrity right there.
And I think too, the asking for personal client data is it funnels from the top down, and the people that we serve can feel the distrust. You know what I'm saying? Like, cause it got, you know, if it get to the point to where my supervisor doesn't trust that I'm out doing what I'm saying I'm gonna do, saying that I'm doing, and I'm out building relationships in order for the numbers to get the numbers, and so the community feels it. You know, because that's I won't do it. I refuse to go out and chase numbers. You know, I'm going out and I'm building relationships. You know, and so I was, you know, we was just, I guess we just, the people that, you know, our supervisors, our superiors was just like, they was like, okay, it's gonna take a minute for us to get some numbers, and they were patient, and the numbers came. You know, but if
One last point on that, Ray, is, you know, a lot of times because I get with this people, so like funding and stuff like that comes from on the top, and bean counters count beans. But where we work is bean soup. Okay, there's no way to count that. So I look at accurate reporting, absent names, is how we make the individual relevant. Because we have to find a way to make the person mean something in a numbers way. And so we got to be that transition with our reporting. And if we do it accurately and detailed, you know, Rachel's extremely good at that, then the numbers will reflect something, and they don't need names or anything, but they get a better picture. So that way they go to whatever funding source it is and be able to get that taken care of.
Yeah, and I also think that Arlene she's not giving, you know, our leadership credit, you know, because without them, we wouldn't have been able to, we wouldn't even, without their leadership, without their wisdom, without their guidance, and without their freedom, giving us the freedom to just, you know, do the work, we wouldn't have been able to do it, impact these communities the way we impact them. So you know, having a superior with an outreach heart, you know, really helped.
We have two more questions. I doubt we'll have time for two, but I'll at least get one in there. Have you run into issues having participants feel uncomfortable when people from their communities are now providing services? This person says, I work in a very rural small community. All people who work at our syringe services program have lived experience. Sometimes you can tell a participant is very uncomfortable seeing someone they know, especially when they used to use together. We always let them know everything is totally confidential and the workers are non-judgmental and kind, but we've heard from other participants that some folks won't get supplies due to this issue. Any advice?
It'll happen in time. It's something don't even need to talk about. If you know yeah, it'll happen. You don't need to talk. If you're about it, you don't have to talk about it. You just be about it. You know, let your feet do the walking, do the talking. You know, and it just takes time. Like it's not being invested in outcome, being having an open mind and having an open heart to genuinely help folks. It's gonna come off, and eventually that suspicious person will probably be the one that end up working alongside you. You know, so.
I think there's also a room for, if the person's doing the work, see somebody, I think there's also an opportunity to reach out and kind of, yeah, we know each other and how you been, and this is where I'm at, and kind of be inviting. I'm a huge fan of the invitation, especially the personal invitation, because that lets them know we're still human. Hey, we have this little history, and this is where I'm at right now. This is where you're at. Doesn't mean we're different, but we you know, let's see if we can still do this part of this together, whatever it is, and just find a way to be inviting and welcoming, and saying what you're doing is great. Thank you for coming in. What can I still do for you? You know?
All right. Well, everyone, it is just about 10 o'clock, and I really want to appreciate these panelists for taking the time today to share what they've done and share their stories, and for all of the work that they do to make a difference every day. So thank you so much to Rachel and Felony and Roy for joining us.
Thank you, Shelley.
Thank you.
Thank you, Shelley.
Thanks, everyone.
All righty.
Okay, so now we are going to stream one more video. Well, one more for today, and then we'll have one later in the afternoon as well. I wanted to introduce Homeless Youth Alliance's video. And if you weren't here yesterday, when we thought that this symposium would be an in-person experience, we had planned to have some site visits to some of the incredible organizations that are doing work around San Francisco so that people could see some pieces in action. And when COVID got in the way and made it impossible to do that, we partnered with a filmmaker and worked with these organizations to put together some 5-minute or so virtual site visit videos for you. And so today this morning we're featuring Homeless Youth Alliance with the work that they're doing. And we're really looking forward to sharing this with you.
Hi, my name is Mary Howe. I am the founder and executive director of Homeless Youth Alliance in San Francisco, California. Our mission is to meet young people experiencing homelessness where they're at, to see them all as the individuals they are with unique experiences and life stories, and help them build healthier lives for themselves and their community.
You guys helped me out and have supported me through a lot of my tribulations, and I haven't been in prison since 2016, and that was a big part from you guys helping me.
They kept me alive for many years.
You guys seem to just genuinely care and I don't know, understand, I think, a little more on the level.
As soon as we build rapport with someone and work with them, we will continue to work with them regardless of where they are. So that could be even if they move neighborhoods, that means if they go to jail, if they go to the hospital, we continue to support and work with people as long as they need us to. And often that can even be after they've secured housing and have gotten off the street. Sometimes that can be one of the hardest times. You know, we have a transitional age youth housing program located in the south of Market. We've had that for a few years. We opened the second safe sleeping village. Ours is called Camp Community Action Made for People, which has about 40 residents. That has been really fascinating. We do street outreach where like the outreach counselors hand out supplies, and that is everything from like medical supplies, hygiene supplies, food. Young people sit on all of our frontline hiring committees. They decide the supplies we hand out, how we do services. And it's like through those really meaningful connections and relationships that long-term change is possible. But it's like you only get there by handing out socks and snacks. And for people who are using drugs, safe injection supplies, or through our medical clinic. And they see time and time again through our consistency and our openness that like we are people to be trusted, and we are different than maybe other programs and systems that have failed them. I continue to be in awe and amazement of the very profound and simple gesture of truly seeing and accepting people and allowing them to participate and facilitate what change looks like in their own lives.
I started going to the HYA because of the resources that were available. I wanted clean needles and clean cookers and all the things. When I went, I started realizing that there was so much more available to me. They continued to engage with me and like teach me different harm reduction practices, which like allowed me to survive. They gave me hope until I was in a place where I could actually have hope. They helped me stay alive long enough for me to be able to like actually get clean and change my life. And like now I have 2 young sons that I care for, and I have a little over 5 years and 8 months clean. You know, I feel like our ability to change is directly corresponds to our ability to be honest. I had this narrative that like getting loaded was so adventurous and so cool, and like being homeless was also punk rock and like so cool. And going to the Homeless Youth Alliance, I was always met in an engaging and empathetic way that made me feel human, like human enough to be able to have hope that maybe my life would eventually change. And they made being clean and being like a productive member of society an attractive thing. Once you have felt somebody else help you better your life, you kind of feel compelled to give back and do the same. Like, I just didn't think this was possible for me. I didn't think that I could have a house or children or a job that I loved. It's extraordinary, you know, and that's a direct reflection of the Homeless Youth Alliance.
Oof. I've seen that video a number of times and it gets me every time. All right, well, now we are going to try something a bit ambitious for a webinar, but we really wanted to make this experience as interactive as we could. And sometimes in a webinar format, it's very passive. You're sitting there just taking it in, but not able to engage. And so we are going to move you all into a different Zoom meeting where you will be able to join 2 breakout rooms where we have 2 low stress sort of simple prompts, and we just want you to have a little time to engage with a small group of fellow attendees and answer some questions and talk together for a brief time. And then we will come back for a pretty incredible closing plenary talk. So definitely make sure that you return at the end. We'll give you the link at the end of your breakout link so that you can come back here to the webinar. So I'm about to put a link in the chat, and you should click that link. And you will be asked if you want to leave this meeting. You will likely get a little message that says, in order to go to this new meeting, you want to leave this meeting. Is that what you want to do? And you should say yes. It seems like it's all one big thing to you, but you're actually leaving the webinar and going to a different Zoom meeting. So say yes. And then you'll all be in a big room for a minute while we get everything organized. You can just sort of chat and take a breather, and then you'll be put into breakout rooms. And there will be someone in that room who will help you, give you the prompt and talk to you. You'll have 15 minutes. You'll go back to the main room for a moment, and then we'll put you in new breakout rooms with a new set of people so you can make new friends and do that for 15 minutes. And then those rooms will close. You'll come back to the breakout room. There'll be a link to click and come right back to the webinar to hear Janetta Johnson speak, which I promise you don't want to miss. So that's what we're doing now. I really hope that you head on over and get some engagement and have some good conversation in the breakout rooms. And we'll be back with you in a little over a half hour. See you then. Putting the link in the chat now so you can see it there. All right, everyone, welcome back. I hope you had a good experience in those breakout rooms. It seemed like there were some really good conversations happening and the technology worked, so yay. Now I'd like to close out the session by introducing the incredible Janetta Johnson, who is here to close out the day with what I'm sure will be a talk to remember. Janetta is the executive director of the TGI Justice Project here in San Francisco, and is going to speak about a topic we don't discuss enough: intersectionality of multiple identities in harm reduction, especially people who are Black, Indigenous, people of color, and trans and gender nonconforming. So I welcome Janetta, and here you go. Thanks.
Hi, yes. My name is Janetta Johnson, and it's really nice to be here today. I'm currently in Alabama. I'm here working with an organization called TAKE, Take, a Black trans-led organization. And a lot of the work that we do at TGIJP is working with transgender people that are coming out of jails, prisons, and other locked facilities. And I just had an opportunity to make some strong observation, especially when we think about harm reduction and supporting various communities that they serve and all the intersections of who they are and what they bring. And it's like and organizing, centering Black trans people, but also just supporting supporting trans people that struggle in some ways that some of us might not be right now. And looking at the intersections of mental health, substance use, and a big observation that I made looking at some of the folks that we work with, and I'd say like the majority of the folks we work with have been through the foster care system or have been living and on the streets since the age of 13, and is currently like in between the ages. The youngest person is 19 and the oldest person is 34. And just looking at all the challenges and experiencing and really trying to pay attention to what's the investment that's needed, working with that particular population and like looking at sort of kind of like how do we triage all those issues and what is needed to be invested in to better support those population and helping people evolve in the way that um, that they might need to create safer situations. Because for me and for TJ at JP, it's always about putting people in safer situations. And we're trying to find out like the adequate harm reduction measures, tools, and even like during COVID-19, we picked up about 24 to 30 people that we were housing in different hotels. And we finally had the opportunity to put them into SROs. But a lot of the folks that we've put in SROs like have numerous evictions and some of them never even paid rent, are not familiar with paying rent, have no desire to pay rent. But having conversations and working with them and calling them individually and checking in with them and explaining to them why they should reconsider paying rent so they don't have to go back to the streets, trying to really break it down and figure out what are the needs, what are the barriers. And I think that there's a lot of harm reduction structures that need to be placed, but it's always an issue of we don't really have the staffing or the money's not there to support people in the way that they need to be supported. Because if you think about all the intersections of trans people experience, especially when you talk about Black and Brown, Indigenous, undocumented folks, it's like the fear and anxiety that people live with, and how do we I always go back to how do we ensure that they have equal access to opportunity and make sure that they have the attentiveness they need. I live in this city, and I could say that my eyes and ears are always on the ground. I'm always trying to strategize on how to help people and move people to where they say they want to be moved to. And I've seen social workers and case managers take people and just take them to the park and play baseball throw the baseball and catch the baseball. But all of a sudden, like that person who is sort of kind of like a harm reduction specialist trying to get people involved in any other things and trying to get people's mind occupied on their habits or the things that they really like and bring them out of the survival mode that a lot of our folks that we work with are in. Like everything is survival, and just kind of like redirect some of that energy into like finding something that you enjoy doing and taking the time out to do that, and not and find out what some type of normalcy is outside of your everyday struggles. Because if people don't know what life could be like for them outside of their struggles because they've been in it so long, and I just think about people making better decisions on harm reduction, stress reduction, coming up with solutions for a better sense of sustainability and what that might look for them, and what do they need to feel safer in their existence. And especially since we're living here in San Francisco, it's really, really challenging for a lot of people to like hold on to too much hope, because for some group of people, this is a very disparaging city. This is a very scary, disparaging city. And it's like, that's why it's so important to really, really focus on harm reduction. And because I don't think that the traditional drug treatment opportunities is going to work for somebody, but I've learned, especially in this 6-7 months of COVID-19, how each individual safety or create a safer sustainability after like having to call like 20 people and really negotiate, I need you to pay your rent, you know? It's like, and I just think of, I could just imagine like just me and my director of housing and supportive services, Joe Nathan. It's like we identified that if we had more people to work with the people that we're working with in the way that we were working with as many people as we can, that I think that we could, that would be a great exercise and an opportunity to keep people into permanent housing. But it's just, there's not enough to go around to make that happen. But, and that's what a real investment, working specifically with keeping people in San Francisco Bay Area safer, because we know that people have been chronically unhoused. And, you know, this all ties into all the moves and the shifts that we want people to make in their life. It's like, if they are housed, the better chance they are in their decision-making process, better chance that hopefully they can get more good night's sleep. Because, you know, we need a good night's sleep in our decision-making progress. All of us here, you know, yeah. So thank you.
All right. Well, thank you so much, Janetta. We're really happy to have you here. And we're happy to have everyone join us for this session. Thank you so much for joining us, and special thanks to all of our presenters today and the people who helped make these breakout rooms a success as well. A few notes. One is that I forgot to put the link in the chat for the Homeless Youth Alliance video. And just in case you want to watch that incredible video again or share it, I'm going to go ahead and put that in the chat now. So please feel free to watch it and share it widely. We'll be sharing with all of you at the end a link to an evaluation and the link to all of these videos so that you can re-watch and share any of the videos from the entire symposium. I also want to say thanks again to the National Association of City and County Health Officials for their funding that helped make this happen. And our final session is in 1 hour. We'll be talking about harm reduction in the era of COVID. Very timely topic. And we'll be speaking about self-care and having an opportunity for some other interactive activities. So thank you all so much. We'll see you then.